Can you tell us how you engage these women within your organization to better the lives of those affected by cancer?
I attended yesterday. A group of representatives from patient groups had a chance to meet with CAPTH and give some feedback on meaningful engagement. And I wish I had just recorded it because, yeah, it was a great discussion. And really the takeaway was strong engagement is getting input and feedback before decisions are made. And as a small but very entrepreneurial, busy charity, we sometimes get our timing a bit off too, but I think our best work, whether it's on the education side, the support side, engaging our women in advocacy issues, the best work comes from engagement really early in the whole process. So what we do is we build community for young women with breast cancer. It's through that community that we are able to identify gaps in care and in services. And then we really try to inspire our community to work with us and together to create the solutions. And I would say it's been over 15 years of learning from patients. The learning still continues, and they just have a lot to say, and they always surprise us, but we love it. Our challenge is really engaging our young women in the issues that are being discussed here at this symposium. It's our metastatic women that are really engaged in issues around drug approval and access. The challenge is that those women are the most ill. So we work very, very closely with young women with metastatic breast cancer, and then they pass away. So building continuity is difficult. Just at the end of March, we held a workshop for our metastatic women and really wanted to look at values and patient values in anticipation of the types of things that we're here discussing. And there were some women who we really wanted to be there, and they're napping 2 or 3 times a day right now. Like it's just not possible. And we had a number of women who we've worked so closely with for a couple of years, and they've passed away. We lost a number of amazing advocates this year. So the working with our young women, it can be heartbreaking. But when you work so closely with them, building the community and the resources and the campaigns, their involvement and that meaningful engagement is their legacy too. So it does kind of ease some of the heartbreak. Yesterday's panel talked about the need to engage the broader public in the issues, and we couldn't agree more. We think the issues our metastatic women are facing should be everyone's issues. Everyone needs to get involved to find solutions. So whether it's not just the women with early breast cancer, who for the most part, I always say, you don't know what you don't know. So even if you've been diagnosed with breast cancer, you get your diagnosis, you find out what treatment you're going to be having, you put your head down, you try to get through it, you look to Rethink and other organizations for support and finding that new normal afterwards. And for all intents and purposes, you move on. You don't necessarily worry about or are concerned about, is the new innovative drug that's available in the States or somewhere in Europe, did I need that? You're just kind of going through it. And let alone our broader audience. We're unique in that we serve patients, but we also have a whole group of young people, millennials, that are engaged in our events and in our education programs. And, really, it's wonderful that the DeCoteau process is so transparent. It's all up there on the website. How can our job is going to be, taking that information and trying to make it engaging and bold and relevant for our young audience so that they can understand the issues and understand that there are some challenges right now in healthcare. And, it's going to be a challenge, but we're up for it. You may see a whole bunch of BuzzFeed type videos out there from Rethink because, again, I agree with yesterday's panel. It's so important to engage broader society in these conversations.